Some public health specialists looked on in horror when Scotland followed the UK's lead. When it abandoned contact tracing, Scotland had just 60 confirmed cases.
The guidance from the WHO has always been clear, and that's the bread and butter of public health. It's called shoe leather epidemiology. You're trying to get to the reservoirs of infection. So contact tracing is a core tool of public health. Everybody knows that. And so I was bewildered as to why the government had abandoned it and was taking the London line and London-centric approach to this epidemic.
Professor Pollock was so concerned she wrote to Nicola Sturgeon and Health Secretary Jeane Freeman. In her email, she said she was increasingly concerned about the apparent failure to implement fundamental public health measures. At this stage, she said, it should be possible to contain the disease.
I haven't had a response yet, and I sent a reminder and I've still not had a response.
The Scottish Government said it would reply to Professor Pollock in due course. Since the beginning of this pandemic, the World Health Organization has been telling countries to test, trace and isolate. One country who's been aggressively contact tracing from the very beginning is Ireland. And I'm about to speak to one of the people who's been leading that strategy.
We saw a lot of countries kind of abandon the idea of doing that very vigilant contact tracing, trying to get in touch with every single person that may have been infected, telling them that they may become cases, asking them to stay at home so that if they became sick, nobody else would get infected. If you can get those people to stay at home and to self-quarantine, you've once again allowed yourself to break the chain of transmission.
How quickly were you able to get a manageable, effective contact tracing operation going?
We went from absolutely nothing to having functioning call centres within about 10 days.
Dr. Martin's team has recruited army cadets, lawyers and university staff to make thousands of calls a day in a bid to contain the virus.
There was a very quick decision taken that we were going to try and contact trace right the way through this pandemic.
Do you think that Ireland's policy of contact tracing all the way through this pandemic has saved lives?
I have no doubt that this has saved lives in Ireland, many, many lives. Now, you're not going to get thanked for it. The people whose lives you're saving don't even know that their lives have been saved. But without question, however bad this outbreak and this pandemic gets, it would have been much worse without the contact tracing.
Based on figures from last week where coronavirus is listed as a factor in death, Ireland reported 26 deaths per 100,000 of population. Scotland reported 51 deaths per 100,000, nearly twice as many.